Vanessa. So my claim is that the Affordable Care Act has a positive effect on the healthcare costs for people in America. So the Patient Protection and Affordable Care Act is the most significant expansion of coverage since Medicare and Medicaid. It's a health reform legislation passed by the 111th Congress and signed into law by President Barack Obama in March 2010. I'm pretty sure you guys are familiar with the Affordable Care Act. So there's 3 points I'm going to make is that it lowers costs by providing subsidies, emphasizing preventative care, and improves how care is actually delivered. So my first point is that the Affordable Care Act, I'm going to refer to that as ACA just throughout the presentation. So the ACA makes health insurance affordable by providing subsidies. Pretty sure most of you guys know what subsidies are because you guys take loans in college. But in case you don't know, subsidy is a sum of money granted by the government or public body to assist an industry so that the price of a commodity or service remains low. So the ACA creates a subsidy system for families that are either low or middle income that provide like a cap on premiums on everybody's health insurance, and the premiums are, I don't know if you guys know what they are, but premiums are like your monthly payments for your insurance. So this caps the money based on the FPL, which is the federal poverty level. And the way this is done is by premium tax credits and cost sharing reductions. So to get the premium tax credits, well, for both of them actually, you have to be eligible, and you're eligible based on like your income and your household size and just a couple other factors. So for the premium tax credits one, it's either applied monthly towards your premium, like directly like off your premium every month, or you can get a tax credit every year when you go to do your taxes. And then for the cost sharing reduction, that's directly for like co-payments and deductibles, like when you go to the doctor and that kind of stuff. So it basically just lowers your out-of-pocket expenses. So my second point is that the ACA emphasizes preventative care. So most healthcare is spent on treatment, and the ACA really emphasizes preventing these treatments even being needed or possibly being needed. So 75% of healthcare dollars are spent mostly on treatment, and only 3% are spent on preventative care. I'm not saying that everything can be prevented, because obviously there are some like genetic diseases and stuff that happens, but with all the different preventative options that ACA provides through each family's insurance, it could help prevent it. So some of the services that you guys, I'm pretty sure some of you guys use it, are the testing you get, like blood pressure tests and diabetes and getting your cholesterol checked, all different type of cancer screenings, and all different type of counseling that are offered, like for eating disorders or depression, and teen counseling, and just different type of counseling that is offered. This also, preventative services also include like vaccinations, online shots. I'm pretty sure everybody gets their flu shot, well not everybody, but I'm pretty sure a lot of you get your flu shot. That's one of the things. So in the long run, even the short run, consumers won't have to pay for treatment for illnesses if they take precautions and preventative options. Just for example, like if you get the flu shot, you get it, then hopefully you won't get sick. And that brings me to my third point, that ACA improves how healthcare itself is delivered. So with this, you should get more, part of it is you hypothetically would get more time with your doctor. So for example, the comprehensive primary care model is one of the ways, and it's bringing more one-on-one, how should I say this, more one-on-one interaction between doctors and patients. So you can call your doctor whenever you want, and you can have access to your medical records, like they're doing more online medical records, so it's easier to do things like if you're out of town, you have to go to different doctors. It's not all on paper to where your old doctor office has to fax it over and that kind of stuff. So we're trying to change from paper medical records to more electronic, so in that way it's delivered better. And for example, like I have Kaiser, and I know I can either call the advice hotline or I can just email my doctor to get right away advice or on what I should do versus going to the emergency room or going to make a doctor's appointment because of that I need to go in, therefore spending more money on co-payments and that kind of stuff. And then also the change of payment, like specifically Medicare, like before doctors used to be paid based on like tests and like each procedure, and like now they're going to be compensated through the health of the patient, and therefore doctors will want patients to improve versus just running tests and getting more money, and they'll save money and energy. So in conclusion, I personally work. Do I still go when time's up?
We'll finish.
Okay. I personally work for Health Benefit Exchange in Sacramento and Human Resources, and I've done marketing events and recruitment stuff over last summer. I did recruitment, and people come up, and even though I was there looking for people to try to work for us, but people come up thinking we're selling insurance, and I've heard a lot of testimonials about people saying that under the ACA, people have been able to actually afford their health insurance now, instead of just going to the emergency room, like people can actually make their own doctor's appointments. So overall, I showed you that the subsidies provided reduced out-of-pocket monthly premium costs, and how the covered preventative services reduce future illnesses, therefore decreasing cost of treatment, and how the new delivery and way of hospitals will push doctors and hospitals to provide efficient care that will decrease consumer costs of getting all these tests done. So overall, the ACA has a positive effect on healthcare costs for people in America.
All right, well, the proposition's pretty clearly identified, although healthcare costs is going to be a broad term, and I assume, for instance, at the end, especially when you're talking about delivery systems, that those costs include apparently the health of the patient. That seems to be the measurement that you're saying is going to be used now, and so I'm going to want some of that difference. Have you got any data that suggests that? And I think that's a little bit problematic, because I think you're setting up a criteria. Either it's premature to have information on that, or you're not going to find that sort of data. There's a good preview of what the supporting structure is going to be. The subject is a little bit controversial. The issue that I find problematic is that you describe a lot of what the ACA is supposed to do, but you don't demonstrate that it is doing that. You explain what the idea behind the ACA is supposed to do on the second point, but I'm looking for the information that says, as a consequence of that, here's what has resulted, and I'm not getting any of that. And on the third point, it's kind of generic, and we don't have any data that makes comparisons. For example, how many more people are covered? How much less are they paying? How many more visits are they able to make to hospitals? How much less sick are they? I'm looking for some data to support the conclusion that you're talking about, and all I'm getting is the same descriptions of what it is that's supposed to happen under the Affordable Care Act. And I think you need some information that shows that it's had this sort of effect. You define what the subsidies are, and I understand how a subsidy ought to work and how it should make something more affordable. That makes sense. Has that been the result? Where's the data? It shouldn't be that hard to say. In 2010 we had X number of people covered, and today we have Y number of people covered, and that's an increase of this many people. 10 million, 40 million, whatever the number happens to be, and that their coverage covers more things than were covered before. That's a way to measure what it is that we're talking about, and we don't have any of that kind of data. the idea on the second point, for instance, that we're going to be emphasizing preventative care, I think preventative care is one of those things that almost all the healthcare programs advocate. Where's the demonstration that has been effective? Like you used the flu vaccine as an illustration of that. And I'm going, okay, so do we have fewer cases of the flu this year? Has it been less virulent because people have gotten their vaccinations? Have we had fewer problems with it? I don't know that, and that's one of the things that you're saying is proof that it is reducing costs for us, and I'm looking for the data on those kinds of things, and it's not showing up here. The last point was kind of an interesting one, where you're saying that there's kind of a shift in how we're evaluating this. It's not going to be based, doctors are not going to be charging on the basis of procedures that they do, but on the health of the patient. So is that survival rates? Do they get like a bonus if their patients go without an illness or they live longer? I don't know how that works, and that's kind of what you were telling us in the other points, and we don't get told how that works here. And again, that's going to be effective. I think that there's an assumption that it's going to be effective, but there's not much of a demonstration that it's going to be effective. So it's well organized. You explain things pretty clearly. Proving things is a little bit thin. The evidence that you have, I think, is you got factual data describing what the Affordable Care Act is, but we don't have any statistical information that gives us the results that you're talking about, and we don't even have authorities or experts who have said, oh, it's so much better now. We've got a couple of personal testimonials and some people that you might have encountered, and I think that that's a little bit thin to prove the argument that you're presenting. All right, thank you.